Awesome. Well, hey, Brooke,
Hi.
thanks for
Hi.
joining us. We're excited to have you share about careers in oral health today, and specifically the Denver Health Dental Assistant Program. So we'll just go ahead and let you take it away.
Awesome. My name is Brook Torres, and I work for Denver Health Hospital Authority. I've been here for a couple years now. I had the awesome opportunity to come on and start this program, the first ever dental assisting program in a hospital ever in history in the country. Um, we have gone, we've had a few cohorts, couple cohorts, they're finishing up. So a couple groups of students and they're getting hired and working here at Denver Health. So we're really, really excited about that. So with that, I actually wanted to talk to you guys about what a dental assistant does and how you become a dental assistant. So before I get into that, just a little bit about me. I never thought I was going to be in dentistry. I never thought I was going to be a dental assistant. I actually started dental assisting in high school. I was a senior in high school, and my mom's best friend worked at a dental office, and they're like, we just need somebody to come see patients and do some sterilization and clean up rooms. And they were paying really good, better than all of my other all of my friends' jobs. And I was like, okay. So I decided to come in. I wanted to go to art school and design costumes and do makeup for the movies. And I was like, yeah, I'm going to do that. And I ended up going and working at the dental office, and I fell in love with it. And they started teaching me more. I started asking more questions. And here in the state of Colorado, you can train on the job. And so they trained me to be a dental assistant on the job. And when I graduated from high school, I was working in the dental office. As I continued on in my career, I noticed that I definitely needed to expand my education because I only had one example of actual dental assisting, which was the private practice that I worked at. And so I wanted to do something more. So I decided I wanted to become a dentist. And so I started going and getting my prerequisites for my bachelor's in science. And I started at Metro State College, and I was working towards that. And I was like, wait a second. I was like, maybe I should look into how much does dental school cost? Because everybody's telling me it's so expensive. And I was like, and what are my requirements and what do I need to do? So I did that. And then I said, well, if I really want to spend that much money on school and spend that much time in school, I think I should go back and to do dental assisting school. So I went to a dental assisting school here in Colorado, and I finished the program, started as a dental assistant, and then continued on with my bachelor's of science. I continued on for a little while, and then I ended up meeting an office manager in one of the practices that I was working at, and she had no dental experience at all. And she was coming in as our office manager. And so I was teaching her teeth numbers, and I was teaching her all those different things. And she's like, have you ever taught before? And I'm like, no. I'm like, you can't ever teach at any of the schools. People have to like retire in order to do that. Like it's hard to get in and teach. And so she's like, okay, well, 5 years later, after I hadn't talked to her in forever, she called me and said, hey, I'm starting the first dental assisting program for a local college here in Colorado, and I want you to head that up. And I was like, education. Never really thought about that part. So I was like, do I really want to go to dental school? Because when you're doing your prerequisites and you're working full time and you're doing everything, I was doing it and I was getting it done. But then I was like, you know what? Let me try this teaching thing here. And I fell in love with it. And I decided education was for me, which my mom and my aunt had already told me many years ago that that was what I was supposed to do. But I was like, no. And so it's best of both worlds. I fell in love with dentistry. I fell in love with teaching. And so I had this awesome opportunity. I started that program, and we ran that program for quite a few years. I've started a couple other programs, including this one. And then before I came here, I was the director at a major college that's nationwide and 16 different campuses. So I came here with Denver Health, and it's funny, the person that recruited me is who I recruited back when I first started the dental assisting program, the very first one. So keep good relationships with people that you work with. Don't ever burn bridges, because you never know, later on it could be a great opportunity for you. So that's about me. I've been in the field now for 24 years. It's really, 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 really hard to say out loud. As far as everything else, I'll go through a typical day with you guys and what a dental assistant does. I'm going to share my screen now. My name is Mrs. Brook Torres. Like I told you, I'm a CDA. What that means is I'm a certified dental assistant. You can get after you've completed your schooling or you've been in the program or the field for so long, you can actually go and become nationally certified. So I went to what is called DANB, which is Dental Assisting National Board, and I took an exam, and actually it was like 3 really long exams. And this is what we also encourage our students to do. And so I'm nationally certified. So that's what the CDA stands for. The EDDA is an Expanded Dental Duties Assistant. And what that means is I've gone through extensive training here in the state of Colorado. We are a lot more liberal as to what you can do as a dental assistant than a lot of other states. Some states you have to have a license just to look at a patient or talk to a patient. I know it's a joke, but really there's a lot. Here in Colorado, we're a little bit more liberal as to what we can do. So we can train to actually place fillings. We can train to place crowns. So a filling is say you have a cavity and they have to take out the cavity part or the cavitated part, and then they have a hole in your tooth. So then now you have to fill that hole with a material. I was trained where the dentist will come in. They usually will get the patient numb. I can't do that as an EDDA. And the anesthetic as it's kicking in, then we'll go ahead and prepare and do that part. And then they get up and they walk away and I do all the work. So I place all the fillings, I'll do all the crowns, that kind of thing. There's some things I can't do in the state of Colorado, and that's in other states as well, but that's what an EDDA does. So we're Expanded Dental Duties Assistant. And then of course I'm a EDDA instructor. So I told you about that. And then as far as slideshow. What does a dental assistant do? So I don't know if this video is going to work, and I'm not going to even attempt it because if my computer was already acting the way that it was acting before, So I'm gonna I'm gonna bring this into the screen, and please tell me if you can see YouTube. Can you see YouTube? No?
We could a second ago, but then it disappeared.
There. Can you see it now?
Yeah.
Okay, perfect. So I'm going to play this video for you. I think I was looking at some videos and I was like, which one really applies? So she kind of shows you what you would do in the day in the life of a dental assistant. It's just a quick 5-minute video.
There is not only one type of dental assistant. Every office is different, and each dental assistant may have different responsibilities and duties. Some offices may have only one assistant, some may have multiple chairside assistants, some may have specific dental hygiene assistants, and some offices even have a designated sterilization assistant who may have responsibility both up front and behind the scenes, keeping everything running smoothly. So for the purpose of this video, I will show you how my day in the life was as a dental assistant while working chairside at a private practice with one practicing dentist. In our office, the day generally starts with a morning huddle where the dentist, the dental assistant, and the business manager discuss all the treatment plans for the patients on the schedule. Once everything is organized and we are all on the same page, if we didn't already the night before, we start making specific trays for each patient that's coming in today. For example, say the first patient is a filling. We'll put all the instruments for a filling on the tray. If the second patient is getting a root canal, then we get all the root canal instruments ready on the next tray. Our office also makes separate anesthetic trays with everything the doctor will need for numbing up the patient. We all pitch in to help each other out. So all the hygienists and assistants together, we all start turning everything on and setting everything up in the sterilization room, such as filling the ultrasonic or taking the instruments out of the autoclave from the night before and filling up all the water bottles and flushing the lines. Then we get the room ready for the first patient. We bring the trays in and we cover everything we're going to touch with barrier tape. After the patient has signed all the treatment plans and consent forms at the reception desk, we will bring the patient back and seat them in the room. Next, we will update their health history, ask if there's any changes, any new medications, and then we will take their blood pressure. Next, the doctor will come in, and if the patient needs to be numbed for the procedure, the doctor will numb up the patient with the syringe that the assistant has prepared. Say this first patient is, in fact, having a filling done. The dental assistant will suction and anticipate what the dentist needs next for each part of the procedure. So after working with the same dentist over and over, it becomes a super smooth process of passing the instruments back and forth. It's called four-handed dentistry for a reason. Once you figure out which instruments your dentist prefers and the order they prefer to use them in, you both start working seamlessly with each other. It's all about anticipation and experience. Once the first appointment is complete, sometimes the dentist will have the assistant take a post-op x-ray. And then the dentist will come back in and make sure everything looks good. If it does, we will walk the patient up to the front. So say the next patient is here and ready. We're going to do all those steps again, but this time, of course, with a different patient and a different procedure and setup tray. While this is happening, depending on the day, sometimes we have an office assistant who helps clean the room, but sometimes it's a group effort. But whoever it is, before we bring that next patient back, we need to make sure that we start getting the room ready. So we need to take everything out, clean it, and set it back up, as well as go into sterilization and make sure all the instruments are put through the ultrasonic and then into the autoclave. Some offices, to help keep everything running smoothly and reduce waiting times for the patient, may work out of 2 rooms. For example, if the dentist is finishing up with one patient, the dental assistant can take an x-ray in the other room with another patient. This, of course, is great time management, but can create lots of running around for the dental assistant from room to room. But as most of you probably know, all this running around makes the day go by super fast. Once the day is over, we clean everything. We might get the tray and room ready for the first patient tomorrow. And of course, we empty all the water lines dry and clean out the suctions. Some other duties of a clinical chairside assistant can be getting boxes ready to ship out to the labs, making post-op calls, and doing sterilization maintenance, such as replacing the cold sterile, maintaining the autoclave, shocking the water lines, etc. I hope this video helped you. Please like and subscribe if it did, and if you're interested on a day in the life.
Okay, so that was just a little quick video. I like to show visuals of what an actual dental assistant will be doing. So you got to kind of see in the room, there's a lot of words there that you probably don't understand, like what's an autoclave, what's an ultrasonic, what's all of those different things. So that's sterilization. That's how we clean our instruments and how we make sure that they're sterile for our next patients. We do that usually typically within the office. Now that's the example of a private practice. Here at Denver Health, we have 8 clinics here. So we actually do things a little differently here because everything is so much different. So like the hospital actually comes in and they come and pick up our instruments and they take them down and they actually sterilize them for us. We have a whole department that does that. So that's a job. That's another opportunity. So with that, I wanted to kind of get into the different, okay, don't play the video. The different career pathways that you can do with a dental like actual education. So as a dental assistant, you can branch into different specialties. So orthodontics is braces. You can become an orthodontic assistant where you're assisting an orthodontist. There's also all the other specialties like maxillofacial oral surgery. You can become a surgery assistant, pediatric dentistry. There's endo, which is like root canal specialists. There's so many different specialties within dentistry that you can branch into. Not only that, but there's also admin roles. So front office. I always encourage all of my students to be cross-trained. The more you know, the more you get paid. So we actually train here at Denver Health both front and back assisting. So you know what the front's doing, you know what the back's doing. So if somebody's out up in the front for the day, you can go and fill in, you can help out. So with that, you can become a dental receptionist. Another one would be a treatment coordinator, where not only are you going through the treatment plans, but you're also helping to explain those treatment plans to patients. So in the back that we get them back, we do an exam, the doctor goes over, hey, this is the treatment that you need. And then they explain what exactly that entails. And then they walk them up front. A treatment coordinator will go through all of that treatment with them. What does that treatment mean? How can we split it up into appointments? If it's just like a filling, that kind of thing, it's probably one appointment. But if there's multiple appointments, we can break that down and say, hey, this is what it's going to cost, as well as what is your insurance covers, all of that. And insurance never guarantees anything, but we can at least give them an idea and a breakdown as to what we're expecting for them to pay, and what their portion would be. So that's a treatment coordinator. They handle like the money, basically. Sterilization assistant and technician. So we have in private practices, we have sterilization assistants. That's usually how most people start out. That's how I started out, was, hey, clean the rooms for me, please. And here, this is how we sterilize the instruments. This is how we clean everything, because those are the basics. So you guys are going to learn that as well. And that could even be something that you work for the department here at Denver Health, or other departments, even other hospitals. They have what is called SPD, which is sterilization processing department. So you could be a sterilization assistant or technician. And then there's dental assistant chairside, which is what you saw in the video where you're assisting. And then I explained to you a little bit about expanded dental assistance, expanded dental duties assistance, which is an EDDA. And then there's also even sales consultant. I mean, everybody starts somewhere and they get into something and they're like, hey, I really like the materials and I really like the people, and I'm a people person. I like talking to offices and going from office to office. And sales consultants, they make really good money too. So then you have an idea of kind of what you need if you're an assistant, and how it works in the office, because that material is something you're familiar with and you're trained on. There's also continued education. So if you would like to continue your education on, you can become a dental hygienist even. So continued education for dentistry or dental assisting would be EDDA. Continued education to expand even further would be a dental hygiene degree. So dental hygiene, it's anywhere between 18 months to 2 years. And they can, it depends on the program. We do have 5 programs here in the state of Colorado. 3 are far away. So there's only 2 in the Denver metro area. We've got 2 in the Denver metro area, 1 in Pueblo, 1 in Colorado Springs, and 1 in Craig, Colorado. So there are opportunities where if you get into dental assisting, which I'm going to tell you, every hygienist I've ever worked with in 24 years of working, if they were a dental assistant before they were a hygienist, they're amazing. Because they understand so much more. It's not just a dental hygienist, just to kind of break down the difference between the two. A dental assistant assists the dentist in restorative work. They can also be a hygiene assistant and assist the hygienist. So what they would be doing is polishing teeth and kind of staying within that scope. A hygienist, they actually do what is called scaling, or getting the hard deposits of tartar or calculus off of the teeth, which we can't do as dental assistants. Only dentists and hygienists can do that. Hygienists can give dental injections, which are shots. So that's why the education is a lot more extensive. They're also diagnosing any type of dental disease, as far as your gum disease, bone loss, that kind of thing. So that's what a hygienist does. There's also a dental lab technician. So if you you get into dental assisting and you're like, I really like the lab stuff. Like, I like taking impressions, and I like, which is that goopy stuff that they stick in your mouth and it's like all over the place. And then they make a stone model, and a dental lab technician, they make crowns. So like if you need to, which everybody deserves a crown, but as far as that goes, a crown, not unlike your head, goes on your tooth to make your tooth stronger because your tooth is broken down and say there was a big filling in it or it got cracked. We have to make it like a little nub and this crown fits over the top of it. So a dental lab technician, they make those things. They also make, say, orthodontic appliances like retainers. They make dentures. They make partial dentures, those different things. So a dental lab technician does a lot of different things. A dentist, I always support all of my students. I mean, since 2009, since I've been teaching, I have had a couple of students go on to dental school. Super proud, super excited. I think dental assisting is amazing though. It's been an amazing career for me. I think that if you want to go and become a hygienist and a dentist, absolutely, but they're always going to need a dental assistant. And as far as that goes, you know, the sky's the limit with your education. I have a student now who wants to be a dentist and I'm like, let's do it. I call her doctor. And so with that, you know, the sky's the limit. Don't give up. You can do it. I didn't give up. I just went into education and I fell in love with it. My mom still says I should have become a dentist, but I got the best of both worlds. I fell in love with dentistry. I fell in love with teaching. So with that, you can become a dental educator. And that's, you know, that was my route. So there's a lot of different career pathways that you can get into. There's probably even more than that, what I have here on this list, but with that, there's so many things that you can do in dentistry. Like I said, I had no idea I was going to be in dentistry and I fell in love with it. And a lot of my students tell me the same thing. They're like, this is really cool. Okay. So with that, what advice could I possibly give you guys? I already told you the sky's the limit. Okay. Being in high school, set your goals high, set your goals to what you want to accomplish. Maybe start out small. Maybe don't also be so hard on yourself and set a time limit, but maybe say, hey, you know, I want to accomplish this. Why would dental assisting be a great program for you? I can tell you that much. Okay. First and foremost, I can tell you about the program here at Denver Health because I helped to build it and make it, I think, the best program out there. I'm not saying anything bad about any other programs because I think they're all great, but why is Denver Health's program so much different? Okay. When we have a dental assisting, like I said, program here, we have 8 dental clinics. With that, let's talk about the different clinics. We have general, which we have 2 here on main campus. We have our main general office. So what does general mean? General dentistry means you see everything. So when a dentist goes to dental school, they become a general dentist. So they have to study everything first. So what that means is they have to know, you know, how to do every procedure. Okay. So we see pretty much any patient, children and up is general. We have pediatric, which pediatric is also here on our main campus down here in downtown. And that's at our web building and they only see children or they'll see older adults, maybe with special needs. Okay. They're able to do sedation dentistry where they can actually put the little kiddo out and they have a better experience if they're scared or they've had bad experiences in the past, just to make it a little bit easier. We also have maxillofacial oral surgery, which is here on our main campus. And then our other clinics are all general, which we have some specialists that will come in and do certain things as well. So there's a lot of opportunity here at Denver Health. And I tell my students, I'm like, you guys probably see things that I've never even seen before because we're serving such a big population. And we're also serving our community. So that's the other thing. And that's a big part in my life that I want to make sure is I'm giving back to the community. And that's what we do here at Denver Health is we very much so we treat and see people that are in need in our area and we provide them with the care that they need. So as far as that goes, the dental assisting training program that we have here, I'll kind of get into that here in a little bit here. I'm sorry, I kind of need to back up. Back up one page there. We kind of talked about a little bit of the duties that you guys will do as a dental assistant. There's some technical skills. So here at Denver Health, I told you it's a little different. We don't do sterilization here. But as far as that goes, everything else pretty much is the same. It's very busy. If you saw her going from room to room, you get your exercise. And it makes the day go by so much faster, but you get to help people. And I think that's the biggest thing too, is why did I get into dentistry? I think the biggest thing about it is I wanted to, like I told you, give back to the community, but I also wanted to help people, not just with their dental health, and definitely educating them as to, you'd be surprised how many people don't know how to brush their teeth or properly, clean them, or how often they should go to the dentist or how often they shouldn't, that kind of thing. So with that, educating, obviously, I love doing that, but making somebody smile is a big thing. A lot of times people will cover their smile and be like, oh, and you're like, why do you cover your smile? And they're like, I hate my teeth. I hate how they look. And so you can help change their confidence and also build that confidence within them. So that's definitely, something. What exactly does it entail and what does it take to become a dental assistant, or like what technical skills that you pretty much, you're working side by side with the dentist. You guys heard 4-handed dentistry, which is 2 dental assistant hands, 2 dentist hands. There's also 6-handed dentistry where now you got 2 assistants in, where you're doing more like surgery, where you need more people. There's also patients that come in and they're scared. I always tell my students, if I had 1 penny for every patient that told me they hate the dentist, I would not be standing in front of you because I would be a very rich woman. They are scared of you. They don't know why they're scared of you. They just know that they're supposed to be scared. Maybe it's family members who have told them, oh, dentists are awful. Dentists are mean. Maybe they've had a bad experience in the past. So comforting that patient when they're nervous and upset is definitely something that you'll do. Dentists, they rely on you guys as assistants. You're cleaning rooms. You're not just cleaning rooms and setting up procedures. You're the bedside manner of the practice, and really you're the heart of the practice as a dental assistant. You're getting those patients back, and you're really trying to get them started and help them on with their everything starts in the mouth. So if they have dental disease in their mouth, it affects your whole entire body. That disease will pump through your bloodstream, which pumps through your heart and your entire body. So there you go. Now I'm getting on my education soapbox there. So we are helping people to become more healthy. Administrative duties, I talked about that. You definitely have to have some people skills. Dental assisting is not a very long program. Here at Denver Health, it is 6 months, but it is Monday through Friday. Really the qualities that you need to become a dental assistant, you got to be a self-starter, okay? Ambitious, motivated, have to have a good work ethic, because this is the thing, regardless of the weather outside, like the last few days, our patients still show up. They come to the hospital. If we don't have staff here, there's nobody to treat them. So with that, you definitely have to have a strong work ethic and be dependable. Online learner. We've learned about online learning the last few years. Okay. Team player, definitely a team player. It's not, this is my room. I'll clean my room, you clean your room. We help each other. And they even showed that kind of in the video too, where, if maybe somebody's out or you don't have that extra assistant, you guys are jumping in. If a hygienist needs a room cleaned, you're cleaning a room. If you're seating a hygienist patient, that might not be your patient for the day. You're jumping in. You might need to check out a patient in the front. You might need to check in a patient. You might need to shovel the front walk. So there's a lot of different tasks and hats that you put on. You have to be friendly. I don't know about you guys, but if I've ever walked into a dental office or anything, and the first person that's sitting up front is like, hi, how are ya? You're like, I don't know if are you going to be working on me today? You're like, are you having a bad day? I can reschedule. So with that, you have to be positive. You have to have friendly attitude. And guess what? You're always learning. 24 years in the field, I do not know it all. If I don't know something, I'm going to ask. If something, there's so many different new things coming out, and I learn something new every day. So that's the fun part. It's not the same thing over and over and over. We change things over quite a bit in dentistry. And you got to learn and grow. You have to have that desire. So definitely, we're always expanding our education here at Denver Health. Some skills that you guys will be doing is you got to see how she was taking x-rays. You got to see sterilization, checking patients in, cleaning rooms, chairside assisting, suctioning, that kind of thing. And then education is in there too. I don't have it here on this list, but you're really, like I said, you're educating your patients. Our program highlights, this is how our program breaks down. Our program is 6 months. It is Monday through Friday from 8 a.m. to 5 p.m. So it is 40 hours a week. Why is like lecture, you're coming in, you're doing your homework, you're doing the workbook stuff. That's about 280 hours of the actual program. The simulation is where you're actually getting in, you're practicing, and then experiment. You're actually in our clinics. So our first month of school, you're here with us here at the school. And then sometimes we'll go into the clinic to take x-rays. You guys learn how to take x-rays. You get certified in everything that you need to, CPR, to be in the clinic. Months 2 through month 6, you basically are in the clinic. You guys are in the clinic 20 hours a week, and you guys are here in school 20 hours a week. So the 40 hours total is breakdown at half and half. So that gives you about 400 hours of experience in our clinics. Seeing things that you may not even know what you're learning yet, because we haven't gotten to that yet in school, but you're like, hey, I've seen it. Now, how do most people learn? Seeing things, watching things, observing. You're seeing it on real patients. You're not seeing it on a Dexter. You're seeing it, you're working with real patients. You're observing our staff and our teams and how they treat our patients, and how patients, they come in and they're scared, or maybe they're mad, or maybe they, they have something else going on. But with that, you get to see firsthand how it actually works. So the total amount of hours for the program is 960 hours. That's the most amount of hours out there for any program. Hands-on learning directly in the industry. You guys are going to be under preceptors, dental assistants, dentists. We also have a residential program. So what that means is dentists will go to dental school, and they have to do a residency, or they want to do a residency within the hospital. They apply. We only take 10 students a year, or 10 graduates a year. And we have that here at our main campus. And so these are graduate doctors. They've already gotten their dental degree. They've gone through school, but they want to do a residency. So we have our residency program for general at our main campus here. We take 10 a year, and they're here for a year. We also have a residency program for pediatrics. So dentists will go to dental school, and they decide, hey, I want to work with kiddos. So they end up doing a residency in pediatrics. That's 2 years. So you're going to be working firsthand with dentists that have already been in school. And then we also take dental students from CU. So we are very much an educational hospital. There's a lot of people that are learning. So it's not something like you're the only one. You actually wear the same color scrubs and the same scrubs that they wear. You have a student badge, all of that. But like I said, you're learning firsthand from people that just recently were learning. So as far as what they're learning and what you're learning, it's kind of the same thing. You guys are learning together, but then also they know how to teach too, because they're pretty new right out of school. So if you decided to become a dental assistant, and you decided, hey, what program, what would really be good for me? I implore you to always do your research. We do have a great program here. Like I said, after completion of the program application, if you wanted to apply, I have a website and a link, and I think I've sent that to you, Audrey, but if not, I can send it to you again with an update of everything. You would need a copy of your high school diploma, or if you got a GED. We've changed this now. It says 18 years of age. We just recently changed it to 17, but you have to have either your GED or your high school diploma. So if you graduate early, we're not going to make you wait a year until you turn 18. It's definitely something that you can jump into. We do background checks and drug screenings, immunizations, all of that, because you're going to be working in the clinics with the patients. So with that, we want to make sure that you're safe, you're good to go, and all of those things are pretty much taken care of. So with that, like I said, I can send you the information, Audrey. But what is the career opportunities here at Denver Health? So first of all, I never knew Denver Health had dental until 2 years ago. And I'm a Colorado resident. I was born here. I've lived here my whole life. And when I got a phone call from my old colleague and she said, hey, you need to come head up this program with me. Come over to Denver Health. I'm like, what are you doing at Denver Health? She's like, we have dental clinics here. I'm like, what? I didn't even know that Denver Health had dental clinics. And they're like, she said, yeah, we have 8. And she used to run all of them. So as the manager. So with that, I was totally impressed that they had that many and that they were serving the community like they were. So as we grow, we've been around for quite a while since 1860. And as we continue to grow with that, we're always hiring to expand our dental clinics. And we're growing within those clinics. We also have awesome benefits. So if I would have known, like I said, Denver Health was around that many years ago, I would have come here a lot longer, a lot earlier in my career. We have, instead of paying into Social Security, we pay into what is called 401A. And that money is something that we can see continuously. So I've only been here 2 years, and I just recently looked at my account the other day and was like, that's pretty awesome. That money, once you've been here for 3 years, is something that you're completely vested in by 3 years. And you can use that to buy a house. You can use that to buy a car. My boss actually did that. If instead of going out and getting a loan for a car or whatever, you pay yourself back your own money interest-free. So you can take that as a loan after you've been here for 3 years. We also have another plan retirement, which is 457B, and that's something you can actually loan against as well. Our benefits, I can tell you right now, if you ever eventually later on in life, when you're doing your family planning and you want to have children, it's $100. That's it. That's all it costs as an employee here at Denver Health. Not to mention they send you everything home with you, diapers. They send a lot of different stuff. It's pretty awesome. For me to be hospitalized, I actually had surgery last year. I'm fine. I'm totally fine. But it's $400. My surgery was $60,000. I paid $400 out of pocket. So as far as our benefits go here, amazing healthcare, great pay. I will say that Denver Health starts our assistants out, our dental assistants out more than the community or private practice starts out. Once you finish the program, you'll be considered a CDA, not the national certified CDA, but a certified dental assistant for Denver Health. And then that would be what your role is. We have a fun work environment. I have fun coming to work. I love the people I work with. And my students are awesome. So with that, it's definitely fun. You're constantly busy. So with that, like I said, and you meet some really cool people. And then PTO. PTO is paid time off. And we get like 6.14 hours every pay period, every 2 weeks. So what that means is we get basically 2 weeks of vacation starting out. And then after you've been here for like, say, I think it's 3 years, or 5 years. 3 years, it goes to an extra week, which is 3 weeks. So you get a lot of PTO. That was my awesome partner over there. She's been here for 13 years. Actually, she's been here for 14 years. Forgive me. She's going on 15. Okay. So with that, we've had people come here and start in high school and retire. And when they retired 25 years into Denver Health. So it's definitely some awesome opportunities here as far as career pathways go and career opportunities here at Denver Health. I don't know if we have anybody on. I see Ron, but as far as that goes, I don't know when you popped in, Ron. So you're probably like, what is this all about?
No, can you hear me?
Yeah, I can hear you.
Yeah, I just popped on real quick. I had class, so I wanted to see what was
Oh, yeah.
what it was all about. So I just want to check in real quick. I'm from
No
Brush High
worries.
School.
Oh, okay. Hi. I'm
Hello.
Brooke.
Hi, Brooke. Hi, nice to meet you.
Nice to meet you, sir.
Those are all familiar faces across the board for me there. I've seen them. We have a lot of interaction.
Very cool. So, but I think that's all. Miss Audrey, is there anything that you needed that I didn't cover?
I don't think so. That was super thorough. I appreciated, hearing all about your background and then all about the program at Denver Health. That was super helpful. Anyone have any questions before we wrap up? No,
I don't think so. That was awesome, Brooke. Thank you so much.
Yeah,
Thank you. Thank you guys
Yeah.
for having me. I appreciate it. And if anybody does have questions, Audrey, I'll send you my PowerPoint presentation too.
Okay.
And then if they have questions, there's our emails on there. But hopefully this is a career for somebody. Like I said, I never thought I was going to get into dental assisting, and it's been an awesome career for me. So
Absolutely.
lot
Yeah.
of
Thank you. Well,
opportunities.
we've been recording and we'll send it out to all of our partner schools so that they can watch it later on.
Awesome.
Well,
Thank you.
so much, Brooke.
Hey, thank you very much, guys. Have a good day.
You too,
too.
Ron.
Thank
Thanks,
you.
Ron.
Bye, Brooke.
Bye.